The Manchester Mental Health and Social Care Trust brings together services for adults from across the region who struggle with mental health problems. It's now applying to become a foundation trust, and here to tell us more about what that would mean and how you can get involved is Project Director Jess Williams and Director of Nursing Adrian Charles. A warm welcome to the show. And before we get on to what it means to become a foundation trust and how the audience might want to get involved, let's talk a bit about what the trust does now, Adrian.
Yeah, we provide mental health services for adults of working age and older adults. And we do that across the city of Manchester, so that's for a population of about 450,000 people. Our adult services are fully integrated with the local authority, so we also provide social care for adults of working age, and our older adults work very closely with the local authority to try and provide an integrated service. In terms of the scope of our organisation, we probably work with 19,000 to 20,000 contacts per year. Right, okay. So it's a huge amount of work.
It's quite a big percentage of the overall population, isn't it?
Absolutely.
And what does it mean to become a foundation trust, to go from a trust status to a foundation trust?
Well, it's a really exciting opportunity, actually. We're kind of already all geared up to go for a foundation trust, and what it is, it's about making sure that we as an organisation put the needs of service users and carers really at the heart of the organisation, and that we become much more accountable to local people, really, rather than the Department of Health will actually be accountable to our members.
So what will it mean? You'll be given a set budget, but you'll have a lot more autonomy over that?
No, it's more, actually, as a foundation trust, you become a separate legal entity and you have your own constitution, and we'll be going out for consultation on that constitution on the 26th of October in the Arndale Centre, where we're going to be with a community roadshow for 7 days, and talking about what our plans are, our strategy is, what our key drivers are, really, and then trying to persuade the people of Manchester to sign up and become part of our trust.
So why would people sign up? What's sort of in it for them and what's in it for the trust?
I think probably one of the things what we're trying to do is to generate a lot of interest in mental health issues generally, and also to promote or rather to fight stigma against the mentally ill. And so we're hoping to use this Foundation Trust campaign and the amount of resource that we're putting behind it to raise awareness around mental health issues.
So as you think, Adrian, the more people get involved, the more people become members, not only will it push the direction of the trust, but I suppose it will challenge those preconceptions that people have about mental health.
I think it has to challenge those preconceptions. 1 in 4 of us will suffer from a mental health problem throughout our lives. They may not necessarily need to use inpatient facilities, but they may need to use facilities at their GP practice or in community services. So it's really important that we generate an understanding of what mental health is about. Absolutely. And I think by becoming a member of the Foundation Trust, we can provide people with information not only about the services we provide, but about generating a real understanding about what mental health is and how you can work with mental health.
Fantastic. And finally, how can people, if they do want to get involved and become a member, how can they find out more?
Well, they can go to our website and they can look out for us in the Arndale Centre and at the many consultation events that we'll be holding across the city over the next 3 months.
Fantastic. Thank you very much. Lovely to meet you both.
Thank you.